Developed to treat type 2 diabetes and obesity is now being used to help Australians living with a debilitating sleep disorder. To discuss further, I'm joined by Dr Moira Junge, CEO of the Sleep Health Foundation. Dr Junge, thank you for your time this afternoon. What is this medication and how does it help with obstructive sleep apnea?
Well, it's a medication that's in the group of GLP-1 drugs that have been widely used traditionally for type 2 diabetes and treatment of obesity. And for the first time here in Australia, it's now got an indication to be used for obstructive sleep apnea, which is a common sleep disorder affecting hundreds of thousands of Australians.
So how does Mounjaro work, and are there any side effects for patients?
So it works by losing weight and losing weight around the tummy and the chest, and the upper airway will actually help with sleep apnea. And of course, like all drugs, it's been known to have some side effects in the trials, and they are mostly things like tummy upsets or the site around the injection site so minor complications have been found.
So how is the medication administered?
It's a weekly injection into tummy area or other areas around the legs.
And in those trials where this has been tested on sleep apnea patients, how quickly have those positive results been seen?
I haven't been involved in the actual trials, but I know that the people involved in the trials have been surprised at how quickly, but it's not overnight. It's many months, if not, say, a 12-month period, depending on how much weight needs to be lost. But the surprising fact was not only the weight loss, but the actual effect on improving sleep apnea and on other sort of conditions such as blood pressure and cholesterol and things that are contributing to a lot of chronic diseases.
Okay. Wow. So who will be eligible to access the medication now that its use has been expanded to sleep apnea by the TGA?
So the people who are eligible now to use it for sleep apnea as indication are people who are living with obesity, which means a BMI of over 30, and anyone with moderate to severe sleep apnea alongside their obesity.
Okay, and it's the first and only medicine for this particular type of sleep apnea. How much will it cost patients?
Yes, although it's on the TGA recommendations, it's not yet on the PBS, so it still is quite costly. A lot of people would find it expensive. It's roughly in line with other drugs of that type. It's roughly about $80 a week for people to access this, and it's not a short-term fix. It'd be a long-term commitment to having this weight loss drug.
Do you see it as a game changer for patients that you're dealing with through the foundation though?
I see it as a potential game changer for those with obesity. You've got to remember there's lots of people with sleep apnea, or some subsection, probably 30%, who don't have obesity. And it would be a game changer if it can be afforded by most people.
It's a really interesting one, and no doubt lots of patients out there will be keen to look into it a little bit further. Dr Moira Junge, thank you from the Sleep Foundation. Thank you very much for your time this afternoon.
Thank you.
Telstra